Hi, good evening. My name is Kelly Mayer, and I have been a nurse for 33 years. I can't believe it, time flies. I actually graduated from KU nursing school in 1987, and I am on track to getting my master's in quality management. And I've been a student now at MNU for a full year. It's gone by really quickly. I can't believe it, actually. I am currently also working at KU, and I work in quality outcomes as a quality outcomes coordinator. And I've been there for just a little over 2.5 years. Prior to that, I worked quite a bit of experience in pre-op and PACU at several different hospitals. I also have a lot of pediatric experience working in urgent care for a pediatric hospital here in town. So I had a lot of varied, interesting careers in nursing as a career, which is nice because there's always other avenues to search out and learn new things. So it's been a really positive experience for me. Let me think, what else? I was going to say that as far as doing evidence-based practice, I see with my job, I'm able to see utilizing this kind of research, working through right now data in my job as a quality outcomes coordinator, obtaining data for bariatric patients and looking for different areas to have a healthier experience for those patients, better outcomes. And one way we've been doing that is through tracking their hydration following surgery within the first 30 days. So we've started with a A3 project with a hydration motivation tracker and doing teaching prior to surgery and while they're in the hospital about the importance of adequate fluid intake so they don't end up coming into the emergency room dehydrated and needing IV fluids. And that's been one area just recently where I've seen evidence-based practice in the job that the role I'm currently in. So it's been really interesting. Another thing you were asking to know about is something different that I would like to see changed with my job. So I take that as the job as whole as my career in nursing, not the position I'm in now. I really enjoy the position I'm in now. But nursing as a whole, I think it should be looked at as the business that it is. So not just the fact that most of the people that are in our profession are there because they really enjoy the helpfulness with their career, their ability to help others and show compassion, but to also treat our career as you would a business with a business ladder. And that route, take more response for having exit interviews and really see what's going on different units with different managers, just like you would with a business, and handle it more in that aspect, that role, so that we're able to encourage people to grow like we would in the business world, and people are treated fairly in their career evolving on the career ladder like you would a business, instead of more that we're here as people that are more empathetic and taking like more of a stance of treating us more as people in the professional world of a business, not just as caregivers, but giving us the opportunity to grow and increase our salary like you would in the business world, which I think it's completely different in the field of nursing in that respect. So that's kind of an earful, but that was what I would change in regards to our profession and looking at in that form. What else? I was telling you about all the different experiences I've had. I've also found a newer clinical expertise in these last 6 months with doing a lot of work with our COVID positive employees, and that has been very enlightening. And I feel like I brought all the aspects of my 30 plus years into helping others, getting assistance during this illness, and having patients set up telehealth appointments and getting them seen in the ED regarding their symptoms and what's going on with them. So that's I can't believe it's been 6 months that we've been dealing with this pandemic, but just another aspect of nursing that I never would see myself in, and yet here we all are doing different jobs during this time to help everybody out. So I'm really looking forward to this class, and like I said, I can't believe I've got a year under my belt so far with masters, and look forward to watching your presentations and reading your papers and all that, and getting to know you all. So I hope you have a great evening, and take care. Stay safe. Thanks.